Hi, I'm Nick D'Angelo, patient coordinator at Sponaugle Wellness Institute, and this is a soon-to-graduate patient. Ma'am, can you give us your first name?
My name is Sheila.
Sheila, so you arrived here pretty sick. We want to hear more about that, but tell us how long you've been sick, and tell us what you knew was going on prior to arriving here.
Well, I've been here for 16 weeks. Prior to that, I had been sick for 4 years. In hindsight, we figured out that I was bitten by a tick. I was one of the people that had the bullseye rash, but being from where I'm from, we don't have a lot of ticks in Arizona, and so I didn't know what it meant. And it was very classic, and I remember exactly where when it was, because I was in an southeast state, and I must have been bitten when I was out in the woods and having some fun, and had a little bit of a flu-like symptoms after that. Actually, this is interesting. I went to the doctor and was diagnosed with it was when that H1N1 was going through.
Wow.
And I just realized that the timing of that just recently. And they said, oh yeah, you've definitely got that flu. So because of what was going on in the medical community at that time, I was misdiagnosed as a flu. Time goes on, and everything started hurting, aching. Probably my first symptom was right here in my arm. Just had a big pain in there. And of course it acted like it was something physiological in there. So they were looking at my shoulder and everything, and they were thinking about doing some surgery on this little rotator cuff here. And about that time, I got the exact same pain in the other arm. And that's when I knew that this pain wasn't coming from the very tiny tear in my rotator cuff. It was something else. Eventually it was misdiagnosed with fibromyalgia, polymyalgia rheumatica, probably a couple other things in there too. Was on steroids for a year, had some wonderful physical therapists that I work with that were able to relieve pain and keep the pain at bay, but nothing was making anything get any better.
Sure. Tell us, when did the prospect of Lyme, when did that become an option? I had gone on a disability, and then my disability people told me I was no longer disabled. Even though I really wasn't walking well, my arm had a tremor to it, I had a foot drop off of one leg and everything. Somehow in there they decided I wasn't disabled anymore. And I thought, well, I've got to find a different doctor who's going to tell me what's wrong with me, so that because I was a high school counselor and had to quit working because I couldn't think. So I actually sought out some testing and was finally tested, and it came out that I have Ehrlichia, which is one of the Lyme co-infections. Yeah, so you arrive here, and you know at least that the bacterial infection in your body is a huge major component of what you're dealing with. In presentation, day one, when you begin at Sponaugle Wellness, what was your chief symptom that you were dealing with, and maybe the first few chief symptoms that you dealt with?
I have to say, brain fog to me was the thing that I didn't know who I was anymore. My brain, I couldn't think. I lost sentences. I couldn't have a conversation with people. I'd started becoming socially withdrawn because I could not feel comfortable in a social situation. So the brain fog, the pain, and it was getting to be a lack of mobility. I would guess that I was probably only a few months from using assistive devices for walking, and maybe even a wheelchair not too far away. So, and then they started me on the protocol here, and within days, the arm thing and the
the foot drop, I was walking, it still kind of hurt, you know?
Sure.
But within days, the very visible walking disabilities were gone.
That's huge, because so many people call in to talk about Lyme treatment, and they talk about the neurological effects of Lyme and what NeuroLyme can do. And you walk in here with you're having the drop foot. You've got all the cognitive issues, and then within days, from relieving stress, from the toxicity, from working to kill off infection, was vastly improved for you.
Within days.
And within days. What of you mentioned that the pain was a huge issue. Pain was a major issue, and how long did that take to really improve in your estimation?
Well, it's like almost every week some other pain goes away. My neck and head, I didn't really want to do this. I purchased the car I have because of the location of the mirrors and the backup cameras and all that stuff, so that I could continue driving.
Right.
But there'd be like one day you're laying real still, and all of a sudden I'd feel one side of my neck going, oh, I'm done being all messed up with this now.
Yeah.
And then, things come out. I had a big old bump on this side from toxins, and it really hurt. And then it just kind of melted away.
Okay.
So everything's real subtle, and it's not like you wake up one morning and everything's gone. But it was, when I first got here, we couldn't take a blood pressure on this arm. It hurt so bad. And so one of the guys, Leo in the lab, is always hesitant, because the first few times he took my blood pressure, it was like, don't make that thing pump up again, and so and now it's like, no, it's okay now, it's fixed.
Right. That's awesome.
Yeah.
Well, tell us, where are you at now? What kind of outlook do you have? Where are you going next? Are you going back to work? Are you?
Well, I did retire from education. I was at the state that, if you have to say, this hit me at a more fortuitous time of life than for many people.
Sure.
I was at the end of my career. I was able to retire from 31 years in public education, teacher, principal, counselor. And so no, I'm not going back to that. But I do sell real estate in Phoenix, and I will go back to that.
Yeah.
When I get back. I'm looking forward to it. I love helping people, and I say I do the same thing I did when I was a high school counselor. I help people make important decisions.
Awesome.
And so I'm really looking forward to that, because, life without contribution and giving is not the life I'm going to be. So I need to be busy. I need to be helping people. And so I'm looking forward to it.
And is there that? And what I'm seeing and what I'm hearing underlined is that you've kind of regained that confidence. You mentioned social, the social, you trying to retreat from social situations and the discomfort there. That's all back too.
Yeah, I had. There was some involvement with my vocal cords and my voice, where I would just, it would just cut out in the middle of sentences, and went to 83 different doctors for that too. Maybe only 4. But I didn't want to pick up the phone and talk to people, because I'd be talking and all of a sudden my voice would be gone. That was my first qualifier for the disability on teaching, because I couldn't give lectures and my voice not work.
Yes, ma'am.
And that's completely gone. And there's just, I'm back. Me had gone away and me is back again. And there's still, you don't leave here completely well. You leave here on your path to wellness. My immune system works again. I went into a natural kill last week where I had a fever, and I'm like, oh, I'm killing stuff. This is a good thing.
Absolutely.
But it was really exciting, because even though I felt kind of crummy, I knew that we had restored my body's ability to fight infection.
Absolutely.
I was on an antidepressant when I came in here. and we've weaned me off of that. And do I look depressed?
No,
No,
ma'am.
I'm not
No,
depressed
ma'am.
anymore.
Right.
And so there's been a lot of things that work better, that are
Fantastic.
pretty exciting.
Fantastic. Well, Sheila, I'm excited for you. I know that this was a long 16 weeks. 16 weeks it's been for
It's
you.
flown by.
But it's we've got your life back, and I think it was very
That's
eloquently
it.
put. It's the
Yeah.
path to wellness. You're on your way, and I'm just so excited for you. We're excited for you. Just keep it up, girl.